Myself, Dr. PAWAN. I am Professor Additional in the Department of Forensic Medicine, TNMC and BYL Nair Charitable Hospital, Mumbai. Today, I will be taking a lecture on spinal and peripheral nerve poisons. In this lecture, I will be covering a poison, strychnine, its sources, mechanism of action, features of poisoning, treatment, postmortem appearance, and medico-legal aspects. Along with this strychnine, I will be also covering two poisons affecting peripheral nerves, that is Curare and Conium. Strychnus nux vomica. Strychnine is the active principle in Strychnus nux vomica. It is used as a rat poison in the Europe during the bubonic plague in the 16th century. In 19th century, it was used as homeopathic and Ayurvedic remedies. It is also called as snake wood, as some believes that this nux vomica can be used for the treatment of snake bite. It is also called as dog button, poison nut, kuchila, and kajra in Marathi. This plant is an evergreen tree having a yellowish white tubular flowers and large oval leaves. The fruit of the plant, the ripe fruit of the plant contains seed. This fruit is having hard shell, having globular fruit, initially green, later on it becomes orange in color. Each fruit contains 3 to 5 coin-size gray velvety seeds that looks like a code button. The seeds are hard and flat. These are about 2 cm in diameter, half centimeter in thickness. The seeds are slightly convex on one side and concave on the other. They are ash gray in color, having shining hard pericarp covered with fine downy hair. The seeds are bitter in taste. The entire tree is poisonous. It contains the active principles in this Strychnus nux vomica is strychnine and brucine. It also contains a glucoside called loganin. All parts of the plant contains varying amount of toxin. However, the seeds are most toxic. The bark, wood, and leaves contain brucine but no strychnine. Strychnine in the purest form is 10 to 20 times more poisonous than brucine. It is colorless, odorless, bitter in taste. It is white or translucent crystals or crystalline powder. Strychnus nux vomica, strychnine, it is absorbed from all the mucous membranes. It is mainly metabolized in liver. The maximum concentration of alkaloid is there in the liver, kidneys, and blood. When blood concentration falls, when blood concentration of the strychnine falls, it is released again from the liver and kidney. This is the reason, this is the cause for convulsion in patients even on second or third day. Its elimination half-life is 10 hours. It may remain in the cadaver for 4 years as it resists putrefaction. Mechanism of action. Strychnine competitively blocks ventral horn motor neuron postganglionic receptor sites in the spinal cord and prevent the effect of glycine. Now, I like to explain in a simpler way. You need to remember that the strychnine acts particularly at the ventral horn, or also called as anterior horn cells of the spinal cord. The cell bodies of motor neuron that send axons via the spinal nerves to terminate on striated nerves. This way we can explain the mechanism of action of strychnine on the striated muscles in the form of convulsions. First, we need to understand how it acts. It acts by competing with the glycine. Now, what is glycine? Glycine is an inhibitory neurotransmitter responsible for switching off nerve impulses. Now, what is this strychnine is doing? Strychnine is inhibiting a neurotransmitter which is already in the inhibitory nature. So ultimately what will happen? There will be a stimulation. So this inhibition of glycine will cause stimulation or continual overstimulation, which will cause ultimately the next excitatory effect, that is convulsions. Now, after the mechanism of action, the fatal dose, it is very toxic. Strychnine is the fatal dose is 30 to 50 grams. One crushed seed. Uncrushed seed, as it will not dissolve in the stomach, it is not having any poisonous effect. The fatal period for crushed seed is 1 to 2 hours. Pure alkaloid may cause death in 5 to 15 minutes. The clinical features. So there will be if the person is coming contact with the crushed seeds or nux vomica, there will be a tingling. If it is ingested, again again here I will tell if the seeds are ingested as it is uncrushed seeds, so there will be no poisoning. However, if there is ingestion of the crushed seeds, there will be bitter taste in the mouth, there will be difficulty in swallowing, and ultimately there will be a convergence. But before that, there will be a prodromal phase in which the patient will experience the increased acuity of perception and increased rigidity of muscles with muscular twitching. Now the convergence is the classical features of toxicity because of strychnine. These conversions are first clonic, that is intermittent, rhythmic twitching will be there, and then it becomes tonic. There will be a stiffening and contraction. It will be sustained. All the muscles are affected simultaneously, beginning with the victim's neck and face. Arms and legs begin to spasm next, and the spasm becomes worse. During this stage, the muscles become stiff and rigid so that the body is thrown into an arc. That condition is called as opisthotonus. Sometimes the body may be arc in opposite direction called as epistrotonus, or in sideways called as pleurostotonus, as described in this figure. There will be, because of the tightening in the chest, there will be difficulty in breathing. There will be blood-stained froth may be seen at the mouth. The contraction of muscle of the face cause widening of the mouth. As the angle of the mouth are drawn wide apart, which there will be creases appearing in and around the eyeball. And this feature is called as rhesus sardonicus, a monkey-like face. The eyes appears prominent and staring, the pupils become dilated. In this whole period, the consciousness is not lost, and the mind usually remains clear till death. Usually the duration of convulsions varies from half to 2 minutes. In between the convulsions, the muscles are completely relaxed and the patient looks well, though somewhat exhausted. The cyanosis, after the period of convulsion, there will be a decrease in cyanosis. There will be pupils will be normal, or there may be again convulsion after 5 to 15 minutes. Because of the slightest impulse, another convulsion may occur. In fatal cases, the convulsion increases in severity and duration, and person may die because of this convulsion. The causes of death because of strychnine poisoning is because of in fatal cases, the convulsions rapidly succeed one another and increase in severity and duration. The patient cannot breathe, leading to medullary hypoxia. There may be a spasm of diaphragm causing respiratory paralysis. There may be lactic acidosis because of the increased activity of the muscle, or there may be destruction of the muscle fiber, which may lead to myoglobinuria, which ultimately person may die because of renal failure. Now, as we have seen the clinical features of this strychnine poisoning, all the clinical features are simulating with the features of tetanus. Here we need to differentiate this strychnine poisoning and tetanus. Obviously, there will be a history of ingestion in strychnine poisoning. However, there will be history of injury in tetanus poisoning. Onset is very sudden in strychnine poisoning. However, it is gradual in tetanus. Convulsions in strychnine poisoning, All muscles are affected simultaneously. However, in tetanus, it is in the groups. Nature, strychnine poisoning, it is if earlier it is clonic and eventually it becomes tonic. However, in tetanus, the convulsions are tonic. Lower jaw, neither starts, however, we are knowing that in tetanus starts in and especially affects the lower jaw. Muscle condition between the convulsion, they are very completely relaxed in strychnine poisoning. However, in tetanus, it is slightly rigid. Fatal period is very short in case of strychnine poisoning. However, death occurs in tetanus after more than 24 hours. Laboratory investigation will confirm the diagnosis. Management, first thing, we need to control the convulsions. First of all, the environment, the person should be kept in the dark, noiseless room as to minimize the stimulation. We can control the convulsions by using diazepam 0.1 to 0.5 milligram per kg IV slowly and then switching over to the phenobarbital IV. If there is more, these are not so effective, then we can go for the general anesthesia, or we can try muscle relaxation using curare or galanine. Short-acting barbiturates like phenobarbital sodium and sodium amytal are the antidotes to strychnine and should be given in the dose of 0.3 to 0.6 milligram IV. Now, important thing here, that role of gastric lavage. As we have stated, the even slightest impulse can cause the conversion to the patient. So as in case of gastric lavage, when we try to, during the convulsions, it will be very difficult. Or if the person is in non-convulsion phase, if we try to insert a tube into his stomach, there will be again conversion to his pressure. So it can be given with caution. Stomach wash with warm water or diluted solution of potassium permanganate or tannic acid may be considered as soon as the patient is under the influence of, if the person is under the general anesthesia or sedation. However, it needs to be carried out very cautiously. Similarly, in cases of difficulty in breathing, their tracheostomy can be done. If the person is dead, then postmortem, there will be signs of asphyxia. In cases of strychnine poisoning, rigor mortis appears very early and there will be a prolonged rigor mortis. There may be occasional rupture of stretched muscles because of the constant strong convulsions. In the stomach and duodenum, there will be patches of ecchymosis. There will be remains of the seed may be seen in the stomach, as the seeds resist putrefaction and can be detected. The strychnine can be detected even after few years of the death. In case of strychnine poisoning, along with the routine viscera, we need to preserve brain and spinal cord as well for the detection of the poison. Medical legal importance. Generally, most fatalities from strychnine poisoning are accident. Strychnine poisoning has occurred through mistakes in prescription. Many times, the preparation, medicinal preparation, there may be a sediment may be present at the bottom of that bottle, which can be consumed accidentally. Homicide with strychnine is very rare because of its intensely bitter taste, and the convulsions will follow immediately after the convulsion. So homicide are very with the help of strychnine is rare. Suicide with strychnine again rare because of the painful. It is a painful death. Sometimes Vomica is used as a love filter and an aphrodisiac and may cause accidental poisoning. Strychnine is also used for killing stray dogs as a rodenticide and sometimes as arrow poison. Other arrow poisons you are knowing, they are Abrus precatorius, Crotin, Calotropis. So other than these arrow poisons, strychnine can also be used as arrow poison. It is said that it is a cumulative poison. This may be due to the slowness because of which it is excreted. The next thing, so this is all about strychnine poisoning. Here in this, about the strychnine, we do need to remember the mode of action, the active principles, what are the clinical features in the form of convulsions, and the treatment. The next thing, the other poisons, they are peripheral nerve poisons, curare and conium. This acts primarily on the end plates of the motor nerve terminals. Now, the first poison, that is curare. It was used in earlier days as a arrow poison. It is also known as curare or verona. It is obtained from the bark of the wood of the plant Strychnus curare, and it contains curarin and curine. The mode of action of curare, it is a non-depolarizing muscle relaxant. So exactly opposite to the action of strychnine, it is a muscle relaxant. It acts at the myoneural junction, occupies nicotinic acetylcholine receptors, causing flaccid paralysis of the skeletal muscles. It is not, it is important here to mention, it is not absorbed through oral or GI mucosa. That's why it is used in the form of arrow poison, as it is getting absorbed through the abrasions and wounds. Curare affects the muscles of toes, ears, and eyes, then those of the neck and the limbs, followed by muscles of breathing. And death occurs as a result of respiratory paralysis. The symptoms occur rapidly. That's why we need, there is a demand of energetic treatment. In large doses, there is a central action too on the nervous system, which may produces a short phase of excitation and muscular movements, and even convulsions, followed by depression with loss of consciousness and respiratory failure. Fatal dose is 30 to 60 milligram. Fatal period is 1 to 2 hours. In the management, the effect of curare doesn't last long. The effect getting wear off in 20 minutes. In the treatment, we have to give atropine 0.6 to 0.2 or 1.2 milligram, followed by 1 to 2 milligram of physostigmine. Artificial respiration, oxygen inhalation, and stimulants are helpful. If there is a death, on the postmortem examination, all the signs of asphyxiation will be there, along with the, if the death is very early in, there will be all the seeds and remaining things of the poison may be seen in stomach. Medical importance, mostly the poisoning from curare is mainly accidental. Curare is used as an auxiliary to general anesthesia, frequently with cyclopropane, to bring about muscle relaxation and to prevent injury in cases of patient where we need to give shock treatment. So in such cases, there could be a accidental poisoning. Curare may be used in strychnine poisoning. It has been used as a poison for arrows and for blowgun darts in Central and South America. Now, the next poison, that is Conium maculata. It is also called as poisonous hemlock, the Socrates poison. It is also called as California fern, deadly hemlock, poison parsley, snakeweed, spotted hemlock, or spotted parsley. Also known as spotted hemlock, as it is having umbilicus plant and so called from the purple spots on the stem. These are fine light green, having fine light green leaves, fern-like pattern, and when it is crushed, it gives off a mousy odor. Active principle, it contains conium and gamma conicin. The mechanism of action of hemlock is it acts on the neuromuscular junction. Alkaloids acts on non-depolarizing blockers causing respiratory failure. It also acts on the autonomic ganglia, which are the action is nicotinic in nature, which will be so there will be salivation, mydriasis, tachycardia, followed by bradycardia. The fresh leaves, when have a nauseating taste and unpleasant odor, Therefore, breath may have a mousy odor. Ingestion causes burning in the mouth and throat. Gastric inflammation will be there, along with vomiting, diarrhea, decreased respiration, increase and later slow pulse, mental confusion, and progressive motor paralysis. So, person may die because of the progressive motor paralysis extending upward from the extremities. Death may occur from respiratory paralysis. But treatment, the fatal dose and fatal period is fatal dose is about 60 milligram of Conium. In the treatment, the aggressive gastrointestinal decontamination shall be done with gastric lavage and activated charcoal. Benzodiazepines can be given for the convulsion. We need to give respiratory support. Forced diuresis is helpful to remove the absorbed poison to prevent renal failure. Medical legal importance. It was very popular in ancient Greece, and it was used in the form of juice of fruit or infusion of the leaves as a straight poison for as a purpose of execution. The Socrates, the Greek philosopher, he was executed in this fashion. Accidental ingestion is most common due to mistaken identity, such as it may be mistaken as wild carrot, parsley, or anise seeds. So this is about the poisons acting on the spinal cord and peripheral nerve poison.